Okay, so let's talk about the hormones behind the hormone, right? The hormones behind the scene. The hormones, the T3 and the T4.
Exactly. So T3 and T4, the thyroid produces 93% T4 and only 7% T3. T3 is the active hormone. T3 is what actually gets in and does work. It influences everything from your metabolic rate, your body temperature, your ability to build muscle, your mood. Every cell in the body has a receptor for thyroid hormone. T3 does the work. T4, on the other hand, is essentially an inactive hormone. It needs to be converted to T3. Here's the reason why the body is organized in this way. Every different type of organ, every different type of tissue is going to need different levels of thyroid hormone. So rather than leave that responsibility up to the thyroid, the tissue does the work. So it converts T4 into T3 at whatever rate it needs to sustain its processes.
Isn't that fascinating?
It's very intelligent.
Our bodies are so cool.
Really cool. Yeah. So, but nonetheless, both of them are important. So when we're looking here at T4, the range I prefer to use is 6 to 12. So at 7.9, not too bad. Again, she's within range. Her thyroid is producing T4, so that looks great. I'm going to, for now, skip T3 uptake, skip free thyroxine index. In short, both of those reflect how the thyroid hormone is being used. Is it able to bind and actually convey the message that it's supposed to convey? Are there other hormone balances? Are there proteins? So there's a lot of other things that we can look at from that perspective. But I don't want to get too confusing. And so right now we're going to skip to T3, the active form of thyroid hormone. So here we're looking at total T3, just like we looked at total T4. We're going to talk about total T3 now. Just like we talked about total T4, we'll talk about total T3. So total T3, as I mentioned, it's the amount of thyroid hormone, the active thyroid hormone. 100 to 150 is the range I like to use for total T3. And so at 106, not too bad. Could that be a little bit higher? Sure, but again, it's not too bad. It's still within that optimal range. And one quick distinction, because I am saying total T4 and total T3, and we'll talk about free T4 and free T3, is that the totals just represent what's coming out of the thyroid. You can kind of conceptualize it in that sense. From there, we need the free levels of the hormones that actually get in and do the work at the cellular level. And at the cellular level means how we feel, how it makes us feel. So totals are important, but then we also need to look at the frees. What is bioavailable to do work in our body? So now